Cannabis is an herbal drug. It contains chemicals called cannabinoids, including delta-9 tetrahydrocannabinol and cannabidiol. The cannabinoids in cannabis work by binding to specific sites in the brain and on the nerves. There are over 100 cannabinoids in cannabis, but THC and CBD are the most well-studied, and cannabinoids are found in the highest levels in the leaves and flowers of the plant. Cannabis is commonly used as a recreational drug, and people also commonly use cannabis for multiple sclerosis and nerve pain. It is also used for nausea, vomiting, migraine, and many other conditions, but there is no good scientific evidence to support these uses. Cannabis is by far the most widely cultivated, trafficked, and abused illicit drug, and half of all drug seizures worldwide are cannabis seizures. The geographical spread of those seizures is also global, covering practically every country of the world. About 147 million people, 2.5% of the world population, consume cannabis, compared with 0.2% consuming cocaine and 0.2% consuming opiates. In the present decade, cannabis abuse has grown more rapidly than cocaine and opiate abuse, and the most rapid growth in cannabis abuse since the 1960s has been in developed countries in North America, Western Europe, and Australia. Cannabis has become more closely linked to youth culture, and the age of initiation is usually lower than for other drugs. An analysis of cannabis markets shows that low prices coincide with high levels of abuse, and vice versa. Cannabis appears to be price inelastic in the short term, but fairly elastic over the longer term. Though the number of cannabis consumers is greater than opiate and cocaine consumers, the lower prices of cannabis mean that, in economic terms, the cannabis market is much smaller than the opiate or cocaine market. Cannabis impairs cognitive development, including associative processes. Free recall of previously learned items is often impaired when cannabis is used both during learning and recall periods. Cannabis impairs psychomotor performance in a wide variety of tasks, such as motor coordination, divided attention, and operative tasks of many types. Human performance on complex machinery can be impaired for as long as 24 hours after smoking as little as 20 milligrams of THC in cannabis. There is an increased risk of motor vehicle accidents among persons who drive when intoxicated by cannabis. Selective impairment of cognitive functioning, which include the organization and integration of complex information involving various mechanisms of attention and memory processes. Prolonged use may lead to greater impairment, which may not recover with cessation of use, and which could affect daily life functions. Development of a cannabis dependence syndrome characterized by a loss of control over cannabis use is likely in chronic users. Cannabis use can exacerbate schizophrenia in affected individuals. Epithelial injury of the trachea and major bronchi is caused by long-term cannabis smoking. Airway injury, lung inflammation, and impaired pulmonary defense against infection from persistent cannabis consumption over prolonged periods. Heavy cannabis consumption is associated with a higher prevalence of symptoms of chronic bronchitis and a higher incidence of acute bronchitis than in the non-smoking cohort. Cannabis use during pregnancy is associated with impairment in fetal development, leading to a reduction in birth weight. Cannabis use during pregnancy may lead to postnatal risk of rare forms of cancer, although more research is needed in this area. Several studies have demonstrated the therapeutic effects of cannabinoids for nausea and vomiting in the advanced stages of illnesses such as cancer and AIDS. Dronabinol has been available by prescription for more than a decade in the USA. Other therapeutic uses of cannabinoids are being demonstrated by controlled studies, including treatment of asthma and glaucoma, as an antidepressant, appetite stimulant, anticonvulsant, and antispasmodic. Research in this area should continue. For example, more basic research on the central and peripheral mechanisms of the effects of cannabinoids on gastrointestinal function may improve the ability to alleviate nausea and emesis. More research is needed on the basic neuropharmacology of THC and other cannabinoids so that better therapeutic agents can be found. Cannabis is commonly used in capsules, edible products, sprays, vape products, and cigarettes. Products can vary significantly depending on how much delta-9 tetrahydrocannabinol, cannabidiol, and other cannabinoids they contain. Speak with a healthcare provider to find out what type of product and dose might be best for a specific condition. Multiple sclerosis. Spraying a cannabis extract spray under the tongue seems to improve symptoms of MS such as muscle spasms and nerve pain. In the UK and Canada, this product is a prescription drug. Smoking cannabis seems to moderately reduce nerve pain caused by HIV and other conditions, and the pain relief lasts for about 2 hours. Using cannabis might increase the risk for depression, and it can also worsen symptoms of depression and increase thoughts about suicide in those who already have depression. Cannabis use might make it harder to control blood sugar levels, and it might also increase the risk for long-term complications from diabetes.